Good morning to all of those tuning in. This is the Rebel Lemon, and today we're playing Devil in Waves. So this one takes place in a place of healing, where not everything is what it seems, with the dark underlying aspects to the bright and cheery, hopeful hospital. So, with that being said, let's get right into it. Mother, when I grow up, you know what I want to become. What do you want to become, Jacob? Tell me. I want to become a doctor. Mother, I want lives to be in my hands. After years of studying, sleepless nights, exams that never end. And still, no license, no clinic, nothing in my name. I need money. I can't keep living like this in this place. There's a village with no doctors, no clinics, nothing. Maybe I can start over there, quietly. No law interference. They don't ask much. They just want treatment, or what they believe is treatment. Cheap rent, big house. I can turn my apartment into a clinic. It doesn't matter how I treat. What matters is what I earn. Finally, a bigger house for the same rent as my old single room. From tomorrow, I start my clinic here. I'll set up the clinic in the front room. People here are desperate, and desperation pays. Okay. Oh my god, is the mouse sensitive really that high? Also, turn on VSync. Yikes, that's not great. It's kind of... It's kind of floaty. Yeah, it like takes an extra half second. Also, I'm gonna be honest, I think I really hate people like this. Because for me, I do what I do because I genuinely enjoy it. But even if I didn't enjoy it, I would want to genuinely entertain people. Because that's what I enjoy. I enjoy making people happy, entertained, smile. You know? And for me, I know for a lot of people who are in like positions of doctors and what else? I don't know. Any medical thing or in positions where they're helping people. They do it because they genuinely care and want to help people. But I guess I just sometimes forget there are people like this who don't care. Also, what the fuck am I supposed to be doing? I don't know. Just, I don't get why people focus so much on. Oh, maybe I'm supposed to put space, not E. Okay. I got nothing. What am I supposed to do? Said something about getting the front room ready, but I don't know. I don't really have anything to interact with. But yeah. And so I was saying, yeah, I don't get the whole obsession with money, I guess. Money and fame. Like, don't get me wrong. I guess it is nice to some degree. Okay. But like, there has to be a degree in which it just doesn't matter anymore, right? I don't know. Okay, I'm gonna figure out what I'm gonna have to do, and then I'll be right back. So I'll see you in a minute. Hey, so I'm back. So it turns out I can interact with the shower. I wish it mentioned something about that, but it's whatever. I need to purchase medicines to treat my patients. Oh, how I hope there's some patients tomorrow. Oh, okay, so the objective flashes in the top left, but it doesn't stay there. I think an easy fix to this would definitely be like, oh, you hit escape, and the objective is in the corner. Like in the top corner where it is now. Okay, talk to said patient. Oh, hello, doctor. It's such a relief to finally have a clinic here. Could you give me some medicines for my fever and cough? Yeah, sure. Let me bring it to you. Oh, no. I hope we're not giving out random medication. Also, in cases like that, it's not always best to give out medication. I can't afford to give these medications to my patients. I will attempt to make my own medication. I can earn more from this, and I don't care what happens to them anymore. Oh my god. This is what I mean. It's people like this that just start cutting corners and to save money so they can make more money. It's like, this is the problem. But yeah, just so you know, before I continue, if you have a cough and a fever, as long as the fever is not getting to a certain point and going above it, you should actually let the fever run its course and just pay attention to it. Because when you have a fever, your fever is helping your immune system fight off an infection. However, I don't remember what it is, but once your fever goes to a certain level and above, like a certain temperature, it actually starts damaging cells. And that's when you want to apply fever medication or ways of cooling the body, because you want to reduce that damage. But I mean, I guess if you're willing to bite the bullet and deal with, I guess, being sick over a longer period of time, I mean, hey, it's up to you. It's your life. Hello, doctor. Good evening. Good evening. So tell me about your health issues. Oh, I've been feeling nauseous and vomiting most of the day. Is there any medication for this? Ooh, it's been a while. But nauseous and vomiting, you're probably just normal. It's probably nothing too bad. Honestly. Okay, so the first guy, what? He had a fever and a cough? Genuinely, what I would say is basically herbal tea with a little bit of honey and maybe ginger, but basically a hot drink can help soothe a cough, and honey in a drink can also help with that. But basically, you don't need to try and fix the underlying causes with the first guy. Just treat the symptoms, which is mostly the cough, and basically get plenty of fluids. However, it would be one of those things where you would want to keep an eye on the fever. I would definitely have to look, recheck up that temperature. But basically, yeah, that's what I would say if I was a doctor. I'm not, so definitely don't take this as medical advice. I'm just pulling from what I can remember was when I was in school. And for this guy, nausea and vomiting, genuinely, I would at least get him to wait the day out. And if it doesn't get any better, on the second day, that's when you should be going to the hospital. Granted, this comes with the caveat that if there's blood, then you should go right away. But yeah, I would genuinely try to take it easy. Try to eat small amounts of food. For example, If I were wanting like a banana, maybe don't eat the whole banana. Maybe have like only a third, wait like half an hour, and then have a little bit more. And basically just like try to eat healthy, but like snack throughout the day. Have stuff like bread. Just try to have stuff that's easy on the stomach. Try to make sure to keep enough liquids in. But yeah, that's what I would do personally. However, let's see what our I want to be rich doctor does. Yeah, definitely. Let me grab it for you. Really? You're not gonna ask any follow-up questions? What the hell happened to him? Is he dead? Oh, wrong medication. No witnesses. What do I do now? I can't report this. Oh, this is illegal. I need to hide him in the medical room. The medical fridge should keep him from rotting. He gave me the money already. I'll look through his pockets later. Oh no, more should end up like him, or I'll make it happen. I'll move the body to the medical room. The fridge will keep it preserved. Now we wait. Wait, do I have to... Okay, so I don't have to drop it off, but holy fuck. Okay, this is why you don't just drop like your level of quality for nothing. Like, don't get me wrong, there's like a little bit of tolerance. I'm like, it doesn't need to be perfect. And there are times when it's like, okay, yeah, we can cut corners a little bit. We don't need to do it perfectly, but like, that's within reason. Like, oh my god. I really, really hate when corners are cut to unreasonable degrees, or even quality is just lowered to granted, I have, I guess, just high standards for things. Whatever. I'm excited for more patients tomorrow. More patients means more money. Let's give them the real medicine, the one that fixes everything forever. Oh my god. Okay, look, I know this is just a game, but I'm already, like, please let the police show up. Also, I don't know why the game puts me in the same, like, position looking at the floor away from the patient. It's really weird. Oh, hello, son. Oh, hello, ma'am. How are you today? Oh, son, I've been having bad headaches for the past few days. Can you help? See, this is one of those things where I would want to look into it. Because, don't get me wrong, they're a bit older. So I would definitely want to make sure there's no high blood pressure issues. However, this could also be caused by too much screen time, too much loud noise. So, like, don't get me wrong, there's a bunch of environmental factors that could be playing here, but I definitely would want to look into high blood pressure, see if they could, like, cut back on, like, sodium intake for a little bit, see if that helps. I would also have them cut back a little bit on sugar, at least refined sugar, a little bit. Again, for a short amount of time, like a week or two, and see if that helps. Make sure they're staying hydrated. Make sure they're like getting a good amount of time. Like if they watch a lot of TV, making sure they get like a good amount of break. And are not watching it for long stretches, making sure they get out of the house and getting like some walking, making sure they reduce like sound. That's what I would definitely start with this. This doesn't sound like anything too major. However, because of the age, it definitely could be. And that is something you want to consider. But how does our fake doctor do it? Oh yes, definitely. I can give you a permanent medication, madam. Oh, thank you so much, dear. Inner thoughts. A simple blow to the head with a hammer. The problem ends forever. Oh my god, are we serious? Are you satisfied now? Hope her headache is gone forever. Ha ha ha. Oh my god. I'm done for the day. That old lady gave me some work. Jesus Christ. Okay, I'm definitely gonna have to like take some time to like decompress and unwind after this. This is fucked up. What should I do with these dead bodies? Should I sell the organs for money? Let's see. I mean, unfortunately, due to the age of the woman, I think she'd be a bit too old. Though, you never know. Oh my god, look at this guy. He is built. Holy shit. Yo, Doc, how you doing? Oh, doing good, buddy. How about you? Oh, not so good, Doc. I have an issue. No matter how much I eat, my stomach still feels empty. Is there any medication for this? Oh, this one's actually kind of interesting. So what could be happening is a few different things. Like, it definitely could be a tumor pressed on his brain. Basically either preventing signals from reaching the brain from his stomach. However, what I'm thinking, if this has been something they've been experiencing from childhood, they could actually have a type of stomach that is extra stretchy or extra large, which, due to it being able to stretch more than a normal stomach, would actually make it a lot harder for him to feel full, meaning he would eat a lot more trying to satisfy himself because he'd always feel hungry. Granted, I will be honest, I have no clue what you would even do other than maybe a hunger suppressant, but Yeah, that's interesting. Thinking. I need to be careful around him. I can't use a hammer or anything like that. If he finds out, I'm fucked. There's no medication for it, but I'll give you some food. Try working out from tomorrow. Oh, thank you, Doc. You're the best. Give his damn food. A bit of a weird way to put it. But, okay. So... where do I get damn food? It would have to be in the kitchen, right? However... not really... oh, okay, there we go. I ended up missing it. No, actually some interesting cases here. And it's a shame that this guy kinda sucks. I should have bought a gun to deal with those big guys. Damn it, I missed one today. Time to catch a new fool tomorrow. Oh my god, this guy is a fully licensed doctor, apparently. And he not only doesn't care, but he has so much apathy, he'd rather kill patients than help them. That is so messed up. Oh, an officer. Doctor, how's your clinic going? Oh, it's going well, sir. How about you? Yeah, it's going well. By the way, how did you get a license to work here? Could you show me? I'm just joking. You don't need to do that. I came here for my leg problem. I'm experiencing pain in both my legs. Is there any medication available? Yes, please lie down on the bed. I'll have a permanent treatment for this. Oh, thank you so much. Okay, 1, this is a police officer. And 2, if he's having leg issues, I would want to look into it and see, like, what kind of leg issues. Because this could be an issue where, essentially, his body isn't able to pull enough liquid out of his legs, so it puts more liquid into his legs than it pulls out, which, if that is the case, it is actually a simple solution, but if you don't treat it, the leg swells up and it can cause a bunch of issues. But essentially, a compression sock, or like a compression a glove or mitt, depending if it's an arm, actually fixes the issue, to my knowledge. Though you do have to wear it most of the time, to my knowledge. Granted, this could also be a leg injury, which then that would have to be looked into to see if it actually maybe didn't heal well or has some lingering side effects. But I don't think our doctor is gonna be treating him properly. So, allow me to fix your leg. Just straighten. Just a slight twist should do it. I'm going to break it. So, you really should have checked my ID.
No!
Break his other leg.
No!
Let me permanently relieve you. I got your gun as well. Let's finish this quickly with my hammer. Oh. What should I do with these bodies? Should I get rid of them? I can't risk it. I'd get caught. There has to be a way to this still makes me money. I could sell organs of them for money. There are a lot of people who would pay. That would be better. I could earn some good money from this as well. Alright, I'll do that. I won't let it go to waste. But what can I do with these bodies? Maybe I can make meat out of it? There aren't any restaurants nearby in the village. Maybe I could smelt a small place here and use the dead bodies as burger meat. God, I hate this guy. Devil in restaurant. Okay, that is kind of clever. I will say that last one was a bit tough with the noises and the screaming. That one got to me a bit. But yeah, I will say this game irked me. Not... It's tough to explain, but it's not the game itself that irked me, but like how the game portrays like the person doing all this. And it irks me in such a perfect way, because this kind of person is the person I really, really hate. Like, oh, this game just does it so well. So, yeah. Anyways, I'm gonna leave it there. I'm definitely gonna take a small break to myself. De-stress and unwind a bit. I think I could use it. But anyways, thank you for tuning into The Frequency. This is the Rebel signing off. So good night and sweet nightmares.